Perfect.
Boom. So you're texting, huh?
I am. I'm texting.
We had a phone outage here in North Idaho this morning, which was devastating to Dave because he spends most of his time dealing with things on the phone.
The 3 people it goes out for is me, Seth, and our broker.
Yeah. Yeah.
Really?
And we get a lot of calls and texts. And so it was a rather quiet morning, which was nice. I didn't hate that. Dave's anxiety level's been a bit high, hence the bourbon early on.
It does have a rum aftertaste, though.
Yeah. Isn't it? Do you like it or no?
I do.
Okay. It's a, what is that one? Glenlivet?
Yeah. Glenlivet? Glenlivet? I don't know. I don't know how to say it.
That's it. Someone's going
Glenlivet.
to chastise you for saying that wrong.
My bad.
But that one, I think my buddy Grandpa Jim gave me that one. And it's aged in rum barrels. So it has a slight rum flavor to it.
I dig it.
Yeah.
All right.
Anywho, moving on.
Let's go.
All right. We've got John Thurston with us today this is going to be a cool podcast. North Idaho Ketamine and TMS. You promised you would tell me what TMS stands for because I can't remember.
Transcranial magnetic stimulation.
Okay. It's a mouthful.
It is.
It's like right up your alley, dude.
Transcranial magnetic stimulation. Yeah.
So we're going to talk about ketamine today, and it's not the horse tranquilizer that you're thinking. It has a lot of uses. I've used it myself, so I will share my experience with you. Actually, I used it with John under his guidance. And so I guess first, can you give us a quick bio on your background and how you got into this?
Yeah, I'm a psychiatrist and got into this after I had my own treatment back in 2019. For me, I kind of categorize people, 40% of people will be the light switch people. So after one treatment, it is this feeling of, wow, that was amazing. And for me, became a little evangelical about it right after my first treatment. Like the world would be a better place if everyone tried this. And since then, I've realized that's not true, but 40% of people will have that experience of feeling like it was very profound right away. And so for me, I was one of those 40%. And that really inspired me to start using it in my own practice slowly. And that kind of evolved until I could really devote my career to it. Okay. And so it's been a long time coming.
How is it delivered? Because that's probably an important thing to touch on. Like, what's the atmosphere like when someone goes in for a ketamine treatment? You know what? Pause that. Why would someone come in for a ketamine treatment?
Yeah. Lots of reasons. Some people we see everywhere from severe mental illness, meaning people have tried electroconvulsive therapy before they come to us. Trying everything before they come and really struggling with depression, anxiety, PTSD, OCD, or bipolar depression. But also we have, I think, people, I don't know, quote unquote, the worried well. What the reality is pain and suffering is inherent to life, right? Mm-hmm. We're all going to grow old. We're all going to suffer losses. And so pain and suffering is the thing we all have in common. So I think, I call them my psychonaut patients, the patients who maybe have that weekend retreat they do with their buddies once a year, and they go out and they do like LSD or mushrooms. And they're usually pretty prominent people in our society, oddly enough. And just recently, it's a while ago now, I guess, but one of the patients came in and he goes, "That was so convenient." And it cracked me up because with ketamine, you can have a very intense experience. But then you can go home and have dinner with your family, right? So I'm of the camp that, you can have a good time, but it can still be therapeutic.
Yeah. Yeah.
So you brought up something, what?
Transcranial magnetic stimulation.
So no, there was something else. You said people would come in after.
Oh, ECT, electroconvulsive therapy.
Good Lord. I don't even know what that is, but it sounds like I would pick ketamine first.
Yeah, absolutely. So there was a non-inferior study just recently showing that ketamine, this is actually within the last year, showing that ketamine is not inferior to ECT. And ECT has always been the gold standard for treatment-resistant depression, right? People who can't kick the depression, and we're talking severe depression, right? Can't function, can't, hold down a job or relationships. And yeah.
So depression is the main reason why people come in. Is that what you say would be the majority of people that come in for that?
Yeah. And depression can be a symptom of many other things, right? I mean, people with trauma or anxiety probably also have depression, and then there's also things that are depressing in life, like realities, right? I mean, so we also get people with bereavement, people who've lost a child or like, these hardships, and they're having a hard time shaking it and moving on, or finding the meaningfulness around their suffering. And for some, I think I love that phrase of finding meaningfulness in our suffering.
Yeah. That's a good way to look at it. So the lay down the atmosphere for me. I mean, obviously I've been there, but what does it look like? How do you deliver the ketamine?
Yeah. So set and setting is very important, right? I always want people to be prepared that it is an experience. It's not just come in, get an infusion and feel better. And so the set and setting being so important. So during the initial evaluation, getting a tour, but the space, we really try to make it med spa, kind of like, right? It's got to be really comfortable. Lots of plants, soothing music, the aromatherapy, the music you choose is very important. We recommend an eye mask. Also developing a mindfulness practice. And so everybody, but we just hired a new person, and it's not required to work with us, but everybody except one person has had ketamine treatment themselves at the office. And I think that's an important piece because it is a very powerful experience, and just having that. Well, I think the people that work there are also part of the set and setting, right? So the mindset being the mindset you come in with, but then the setting, the environment you're with, which includes all the people that work there.
Yeah.
So I think, you said you're a psychiatrist, correct?
Correct.
So, I mean, I'm a big believer in like the placebo effect and the fact that your brain can control way more than, we can physically, and it can do a lot more. So obviously this has an effect on your mental status and your brain and everything else and how everything works. But for people, we come from a first responder background. And when you talk about trauma or incidents or things that people can't let go of, or things that people are struggling with that are leading to difficulty in relationships and everything else, there's a lot of people in the first responder and military community and veterans that have those type of things. And I'm sure you've probably worked with a lot of them.
Yeah, absolutely.
Is there any caution to doing anything like this or having ketamine therapy if you're still active duty or anything else like that?
Are you talking about like from a medical legal, like if somebody worry about losing their job or like?
Well, I mean, there could be that, but then also just the fact that you're going back into more trauma day after day and those types of things. Like right now, I've left the profession. There's a lot of things that I have that are built up, and obviously doing ketamine maybe lets some of those things go. I'm not sure how it all works, but for somebody that's still involved in a lot of that stuff and having it daily or weekly or anything else, is there a huge benefit to doing ketamine?
Well, I think so. First responder, so that 40% I was saying, another 40% are more the sunrise people, where it's like, oh, it's helping a little,
Right.
And then 20% of people say, in the general population will say it was just weird. I don't think it helped at all. Right. Okay. But in the first responder population, which usually those folks have complex PTSD, which means, it's not just one traumatic thing. It's kind of one damn thing after another, building up,
right.
Shitty situation after shitty situation, and, in that demographic, it is really almost 100% of people. The only reason they haven't had benefit is if they have side effects, which can be nausea, vomiting, can be a deal breaker for some people. I have, theories for why that is, but I think, when people are in it, it is definitely nice if you can have a day, at least, or ideally the next day. I mean, the next 24 hours following a ketamine infusion. I love the metaphor of flipping the snow globe, right? But if we don't make any other changes in our lives, good chance those snowflakes are going to fall right back to where they were before. So really treating it as an opportunity and kind of this time to go to work, which if you're, inundated by stress and you have to do like a 24-hour shift the next day, and you're being, and you have to, because there is a hard, as a first responder and military and, other professions too, there's a hardening process where you kind of have to develop a little bit of toughness so that you can withstand the overwhelming sensations and thoughts that come with doing that work, right? And it is ketamine, by flipping that snow globe. I would say, there could be some thoughtfulness that would go in to make sure that, hey, you don't have to jump right back in to having to be, on point really intensely. Because I don't think it would be negative necessarily, but it could be a wasted opportunity.
Okay.
That makes sense.
Yeah. So almost, not that you would necessarily want to wait until retirement, but like once you got out of that world, you might have better success with treatment rather than going right back into it. Or I guess you're also looking at it like you're kind of giving yourself a little bit of a breather, like going on a mental vacation.
Yeah.
So there's that. The legality side, you run into that, or how's that work for guys, because there are lots of things that are precluded, like you cannot take certain drugs or things like that. I don't know how it plays into when it's guided by a doctor.
Right. Yeah. So I get that question a lot from people who are, in active professions, that they're concerned about drug tests and all that. And on the standard, like 12 drug screen or whatever, it doesn't show up. Ketamine's not tested for. And the half-life of ketamine is very short. It's only 15 minutes for the active drug, and it's metabolized to R-ketamine. And they could, test for the R-ketamine, but really within an hour, the active drug, the ketamine is out of your system or metabolized. So the chance of it, even if they were looking for it specifically to show up on a drug screen, is very low. But then it is prescribed by a doctor. It's not being used illicitly, right? So there would always be that. But I really always encourage people to say, it's nobody else's business between you and your doctor.
Right. That's a HIPAA thing right there.
Yeah, exactly.
Okay. So setting is important. What's it like when they go in the room? How's that set up, and how do you deliver the ketamine?
Oh, right. So we prefer IV infusion, the continuous IV infusion, because you can dial it in. 100% of what we give is 100% of what the person receives. Other routes of administration, like an intramuscular injection, it's about 93% or something, troches about 30%. And then the intranasals between 8 and 40%, right? You can think of if you swallow some or you're having a cold, right? What's going to be absorbed or actually get into your bloodstream, right? So, but then, coming into the room, the process is you check in, right? Or you first the evaluation, preferably on a different day of your ketamine infusion, checking in. And then, so we spend time we have everything you need, but we always encourage people to bring comfort items if they like that, right? So recliner, you sit back, you get the IV placed, going over the treatment for that day. Some people like intention setting, everybody's, kind of different on what they prefer. And then the infusion itself is, you have a little call button around your neck, and we're monitoring your heart rate, respiration rate, blood pressure, all that in real time. And if somebody wants to bump up, you can hit the button and give a thumbs up during the infusion itself. So that's the cool thing about the continuous IV infusion is you can dial in the dose, but also if it's going, ooh, this is not what I thought it was, I don't like this, we turn it off, and then within minutes you're coming out of the experience.
Is there the experience? Every time I hear it, I'm like,
yeah. What does that mean?
That's the name of our brokerage that we just opened.
Our
real estate brokerage.
The experience.
That's
cool.
So every time I hear that, I'm like, oh man, we picked the right area. This is good. Yeah. So I was a little bit of a medic school nerd. What's the action? How does ketamine work in your system? What is it doing?
Yeah. So there's 8 different ways that we know of that it works on in the brain, right? So you can go down the rabbit hole. The thing I find most fascinating about it is how it can shut down the circuit in the brain. We call it the default mode network, but it's basically the circuit in the brain that's going when we're daydreaming, when we're thinking to ourselves. And so a lot of us, we conceptualize the default mode network as being our narrative sense of self. And so when that starts to shut down, I think that's what can lead to that dissociative effect, right? Most of us are very identified with that narrative, right? I am my inner voice, we think in language, and when that starts to get disrupted and shut down, that's why a lot of people will talk about ketamine in metaphors, right? It's hard to, articulate, say, what was your experience like? And they'll hem and haw or use poetry or, examples. So at low doses, people feel relaxed as you go up on the dose, melting into the chair, hovering over your body. Up from there, people can feel like everything and nothing, very significant, but insignificant. And that kind of paradoxical realm is, I think, the sweet spot for a lot of people.
I want Dave to do this so
desperately. Trips me out.
Yeah, I brought some with. No, I'm just kidding.
We were joking about that beforehand.
I'm so nervous to ever try it because I'm hypersensitive to everything. So if you give me a child's dose of Benadryl, I'm out. For 48 hours, man. It just jacks me up. Yeah. So and everything has been like that. I mean, I'm the guy that when I have extreme back pain, I can take 2 Advil and I'm good.
Well, you've never taken any drugs, right?
No. Are you talking about illicitly, smoking weed? No, I've never.
Right.
None.
And you didn't even start drinking until you were
28
yesterday. Yeah.
I'm 29 now.
And you're the only one drinking right now. What's that say? So I don't does that matter?
Ketamine is a really weird drug when it comes to dosing. We start low, go slow. And it does matter. For you, I would start lower. We start most people around 0.7 milligrams per kilogram. They've kind of had their average kind of experience. If they're very naive to any mind-altering substances, then maybe we start more at 0.5, 0.6. If somebody has had a lot of psychedelic experiences before, or they're very comfortable with that idea of having a non-ordinary state of consciousness, we maybe start them more 1 milligram per kilogram of body weight.
I'm already tripping.
Send them.
Yeah.
I don't even have any. I'm tripping right now.
All
what did you just say?
Yeah.
So yeah, like, okay, let me touch on my experience because I've done it twice with you, I think. But I have had experience with other psychedelics a long time ago, mushrooms being one of them. So it wasn't, I mean, it had been, 20 years probably, but it wasn't totally foreign for me to step out of that, out of my mind and have that disassociative feeling. Cause it's probably pretty weird, especially as an adult, if you've lived your whole life without ever having that and then having that. It's trippy. And it can be a lot to take in. The way I try to explain it to people is like you're living your life and you're kind of in this rut, not necessarily a bad rut, but you're in this, wagon rut of like, this is how things are. And this, experience like this removes you from that, at least for a short period of time, and allows you to look at things differently, where you cannot look at things differently because you've been in that rut so long. It's like almost physically impossible without an outside influence like ketamine.
So does this include, I mean, do people typically talk about hallucinations and things? Is this like a modern day peyote that we're dealing with, or like what?
I mean, it can have psychedelic. So classical psychedelics like ayahuasca, DMT, LSD, psilocybin, all work through the serotonin system.
Okay.
And ketamine works on the NMDA receptor, GABA, glutamate kind of. So it's a different system in the brain, but the downstream effects can be similar. That affecting. So we know that the classical psychedelics through that serotonergic action can disrupt the default mode network as well. And so ketamine can do that as well. But ketamine has some added benefits, I think, compared to other classic psychedelics. And there's still a lot of active research. Nobody fully understands exactly how all these drugs work. But the part that's really interesting, the brain-derived neurotrophic factor, which is endogenous BDNF, we call it brain-derived neurotrophic factor, and it's natural in our brains, but ketamine causes that to release in a bigger amount, and so the whole neuroplasticity piece and that kind of so that disrupting that default mode network, I think, can lead to that experience you're talking about, and you did a nice job. People use all kinds of metaphors to try to describe that, right?
It's very hard to describe.
Yeah, but it's most people find it to be an important experience. And then flooding with that brain-derived neurotrophic factor actually causes, neurons in your brain to start sprouting more dendritic spines, which is kind of how neurons that fire together, wire together, that whole idea, right? And so the ability to create new patterns of thought, new behaviors, new idea, is increased. So that's why really treating it, like an opportunity is important.
Yeah, I think it's hard for me to wrap my mind around. Like I said, I've never had any psychedelics. I've never done any drugs, nothing like that. And so to hear he's doing this whole thing. He wants going.
I see where this is going.
He's like, can I sit in the room with him? I have no idea. Like when you're talking about this experience and these things, I'm looking for something tangible, and it sounds like there's really not a lot of being tangible in terms of what you're going to experience, which is, I think, hard for me. I'm a control freak.
Well, yeah, it's really hard to explain. For me, it's very visual, but ketamine's interesting because I could almost pull myself out of it if I wanted to. I almost had to concentrate on not concentrating. That makes no sense. But it was different in, like, if you take mushrooms, you're in it for the ride, and it's going to be 12 hours
until it works out,
until you go to sleep and wake up the next day. But with ketamine, it was like I could relax my body and just like be in the moment listening to, you definitely want to have some good music. Don't bring death metal. Yeah. And I could just focus on that music, and then I'm in the ride. But if something happens in the room, like I could kind of pull I'm still a little loopy, right? But I could kind of pull myself out of it.
And that's kind of like when you were saying that there's a button that you can ask for more or less.
You have you could do it.
So you're not fully unconscious
gone
or anything else. Like you're aware of your surroundings at least.
Yeah, absolutely. Okay. I mean, and you have control over that, right? Of the depth. Every time we talk to you, how was last time, right? We recommend people to do 6 treatments over 3 weeks. I think of it as 21 days to new habit. So, and then putting in a plan around that, right? We talked about the music, the aromatherapy, and eye mask. I'm a big on mindfulness is a buzzword in mental health because it works, right? People can get out of their brain into their body in a systematic way. Brain loves the past, loves the future, but to get it to calm down and just be in the moment when the reality is this is the only thing that exists, me and you, except you watchers out there where, this happened probably earlier. We're not live, are we?
No.
Oh, okay, good. So, but anyways, so the moment, but so spending a lot of time developing that mindfulness practice, and then in the ketamine infusion itself, you have cues, if I'm asking myself, what am I doing here? Then, returning to breath, or, we develop that tool.
That's a key detail, because I did have, like, for me, it was a roller coaster of anxiety of like, oh, what's happening? Like
The
this feels
unknown.
weird. And then, okay, go back to the breath. Or I did the second time I went in, I did have an intention. I don't remember what it was, but, and I kept returning to that one word, and that helped ground me in the experience. Cause for me, so I did it right after I officially retired as a cop. And, I was definitely dealing with some, post-traumatic stress from a lot of things, but, one in particular. And, so I think I kind of tried to use it as that healing process to get me out of that rut that I was stuck in. And, I say it was pretty beneficial. Like when I had visuals, this is very hard to explain. I'll try, but, I could shut my eyes. I'm listening to the music, and it's a very flowing visual for me. Then there was this dark space, and I could see it, and it was very dark and flowing. And my immediate thought when I saw that was like fear and anxiety. But then I was able to recognize that, bring it back to the breath. Like, okay, I can see that. It's not controlling me. It's not taking over. I'm paying attention to it. I'm not afraid of it. I'm looking at it. And then, over time, the flowing would pass. Like it was almost a physical experience that I could see of anxiety and stress that I was getting rid of.
Yeah.
Does that help? There you go.
Yeah. And that idea of, that doing, if we can, 6 over 21 days.
Mm-hmm.
So for me, I always use music for mushrooms as my favorite. I try to be consistent. I use raw sage, so I crush it up and I just smell it, put it in my pockets, whatever. I wear an eye mask. You can still have intense visual stimuli or visual experience even with no light coming in, which is kind of incredible, right? And then I just keep it simple, stupid, returning to my breath. Mm-hmm. And then if I'm going through a funk, I can't sleep or whatever it is, and I'm at home, I can bust out all those tools. I get out my music for mushrooms, my raw sage, I do some breath work, and then, just pay attention to my breath. And I can actually dissociate without any ketamine now because I've paired each experience with that. And the dissociation, what does that mean, right? But I think for what you're describing too, that idea of experiencing ourselves as something more than the sensations and thoughts that we have, right? So for people who are more spirit, or religious, that kind of connection with their creator. If people are more agnostic, atheist, maybe this feeling like, wow, quantum physics is real, or there's something going on. Even people who would identify as being secular or atheist or agnostic, I think, have to agree that there are things about the universe we don't understand, right? Mm-hmm. We can't connect quantum physics with Newtonian physics. We don't have the theory of everything, right? There's things that we don't know. And that humbleness that comes with that, or through that non-ordinary state of consciousness and experiencing ourselves as more than sensations and thoughts. I think most people experience that as a spiritual kind of experience, even if spirituality, they wouldn't consider themselves a spiritual person.
Right. I would say, and my personal opinion is that everybody that gets out of the careers we were in or the military, I don't know what other stressful jobs are out there, but I think it's a good transition.
Anybody working at Verizon right now? Anybody at Verizon?
They're in trouble.
I'm headed there after this.
Days after. I think that's a good way to transition, because otherwise you run the risk of carrying. I know so many older retired guys, and it's like they're doing well, sure, some of them, but a lot of them are stuck in those old patterns, and like you can't get out of those old patterns without some kind of outside influence. Maybe you'd get there with meditation, maybe. But I think something like this is a great tool, and you look at it like a tool. You don't have to look at it like you're doing a recreational drug for sure. But to kind of help you break out of that pattern and find, because that transition from being a first responder or veteran is tough to go into civilian life. It's freaking hard. We talk to guys all the time that deal with that. And it, took me a solid 6 months to a year to where I was like, okay, I'm feeling pretty normal again. I'm not in condition black, red, whatever, all the time now. I'm at a normal level.
Yeah, that's awesome.
Yeah. So sign up, Dave. Let's go. I'll hold your hand.
What are some contraindications? What are some, for people, are there people that you would say, hey, ketamine's not for you? Like if somebody came to you and said, hey, I'm interested in trying this stuff out. Yeah. What is it that you would ask hey, maybe this might not be the right thing for you? Yeah.
Definitely if they have any history of psychosis, right? And have to, the people can become psychotic if they're sleep deprived or they're withdrawing from, whatever. But if it's in the absence of significant outside stressor and they've had psychotic symptoms, meaning, seeing things other people don't or hearing things other people don't, or the intense paranoia, and that can be a little tricky to distinguish, especially when people with a lot of trauma, right? A paranoia can be kind of a symptom of PTSD. So if it's trauma congruent, that's not as concerning, but it might also be a reason to start lower, go slower, right? Because it can loosen your grip on reality a little bit, right? I mean, that kind of losing sense of self dissolving a little bit. If somebody is predisposed to a psychotic episode, that could worsen it, right? So that's an important piece. If anybody has history of cystitis, or definitely if they have any active symptoms like a urinary tract infection or things like that, that would be a reason to delay treatment until that's resolved. Ketamine can be toxic to the endothelial lining of the bladder. So we always ask people how they're peeing.
Keep that in mind for UTIs.
Yeah, thanks.
You're welcome.
Appreciate it.
Okay.
Okay. So, okay. Man, it's such a nuanced subject, I think, because a lot of guys out there, especially from our world, are like so strict against, I'm not doing any drugs.
Well, it's unnatural, right? Like
yeah.
I had ketamine on the ambulance.
Oh yeah. There
right.
you go.
It's a controlled substance on the ambulance. I mean, it just came out when I was leaving, but you have ketamine. So when you tell me, I mean, it'd be the same thing if I went to you and you're like, hey, I'm going to give you a bunch of fentanyl. Well, hold on. Like, what do you mean you're giving me a bunch of fentanyl? Like that's something that I've learned is not good for you.
Right.
So hearing ketamine, I mean, right out of the gate just has a negative connotation.
Or,
for me.
As a cop, like I don't think I ever arrested anybody with ketamine, but when I was in high school, I remember kids, the bad kids, right? They were using ketamine. I don't know how they did it. I never did it, but, like going into a K-hole, they would call it. And you probably heard that in law enforcement.
Yeah. And that usually has a negative connotation, right?
It does.
Most people who are abusing drugs, if they go into the K-hole, they never want to touch it again. And that's, ketamine is used by anesthesiologists for surgeries. And at anesthesia-sized dosing, it's more of an experience of, wow, an hour went by, felt like a second, right? Or you're kind of in and out pretty quick.
I've had that before. I've had ketamine before for that.
Yeah. So, and so that's that whole dose range, right? And just below that dose, and that's different for everyone. I was going to say earlier, I mean, we've had little old ladies in their 80s and at the starting 0.7 mg per kg, they're like twiddling their thumbs going, wow, I still feel like I could drive home. Am I supposed to be feeling something? And then we've had 6'4" Marine Corps guys who look like they could flip over a truck at the 0.7 mg per kg. And they're going, wow, that was so intense, right? So interesting. It is, everybody's very different. That's why we always start low and go slow. So if we know you're a sensitive guy,
I'm a sensitive guy. That's me.
Nothing wrong with that.
All right.
They gave it to my son when he broke his arm and they were setting it in the hospital and he was like 14 at the time. And I'm like, okay, I've done ketamine. I'm like, it should be fine, buddy. But he doesn't do well with any kind of medication. He's probably like you in that regard, like one ibuprofen, he's good.
Oh, yeah.
And he got done afterwards and he will never try ketamine. I'm sure of that because just because the setting, right? He's like, I could feel everything they were doing, but I couldn't get out or verbalize anything. I was like, that was kind of weird.
That sounds awful.
Yeah. I was like, oh man. So I don't know if it's something about the way his body metabolized or the dose they gave him or what.
Yeah. Maybe underdosed, right? I mean, because at a high dose, sense of self isn't dissolving. It's, being shut out of, and so you're unconscious.
Right.
You're
so
not aware. I mean, you don't have memory of the experience.
Yeah.
Right? So the fact that he remembered the experience means probably was underdosed. And that's that dose. The K-hole range is the dose just below unconsciousness, right? Where you're conscious of slipping into unconsciousness. And it's like you're going down a black hole and it feels like you're going to die and you're never going to come back out. And it's maybe 5% or less than 5% of people find that to be therapeutic. It's like that complete ego death kind of thing, but you have to want to go there to go there. Wow. I did it one time. I never need to do it again. For me, it was just scary. And, I didn't find the therapeutic value in that.
Right.
So I think like getting to that, working way up to that paradoxical feeling is usually a sweet spot for dosing. And if you continue to go beyond that, then you start to tiptoe into that K-hole range, which, like I said, 99% of people probably don't find that to be too therapeutic.
Right. Yeah. That feeling of,
you're dying.
Yeah.
Yeah.
Like, this is it.
Right.
And then the panic and oh boy. So, the normal, The ideal treatment plan is 6 sessions in 3 weeks.
Ideally, yeah.
Okay. And then how often would someone need, like if they got relief from it, how often would they need to redo that, or what's the status?
Yeah, we do that case by case basis, right? I'd say on average is every 3 months or so. And even that gets longer and longer in between. So I've been at 3 to 6 months. I'll do a booster for quite a while. Sometimes, stress. I mean, for me, I love the metaphor of white knuckle driving. So for myself, I start to notice like all these decisions, and I get stressed out with my work, my family, all that stuff. And then after a ketamine infusion, it just kind of feels like I loosen the hand on the wheel a little bit, and kind of a feeling of back to basics for me. I think a lot of people have described this feeling of, wow, why did I care so much about all this crap? I mean, all I got to do is drink water, eat food, sleep, be a nice person. The rest is kind of bullshit, and back to basics kind of feeling.
Yeah. It left me with a sense of well-being that lasted for weeks of just like, good.
Shrug it off.
Yeah.
So going back a little bit, what got you into doing ketamine? Like, I mean, that's
curiosity and life.
Just get
I was
curious about it.
I used to do a lot more addiction psychiatry.
Okay.
And I was at an addiction conference, and I met a group of researchers who were studying ketamine and its use for addiction and its effect on the default mode network.
Okay.
And when I started diving into trying to understand the default mode network, that's when I was like, wow, I got to try this. That's fascinating. Like, to disrupt my narrative sense of self. Like, that sounds crazy.
Yeah.
And I was also going through a hard time. My wife was still in training. We had our first baby. I completed residency in 2017. And so at that point I was a couple years in, but new baby, wife still in training, and feeling like I was kind of trapped in my job. I was working with addiction and then severe mental illness, like on a PAC team, which is a very difficult population to work with.
That's a lot of trauma coming into you.
Well, yeah, it was.
Right.
And I kind of also going, what did I do? I don't want to be a psychiatrist anymore, kind of feeling, and then, ketamine for me was helpful in this way of kind of shifting that suffering to going, the fact that maybe I don't want to be a psychiatrist anymore means maybe I'm a good one, because our medical system is terrible, and mental health is probably the worst part of our medical system. I think a lot of people would agree with that. So, our inpatient, if you've ever been on an inpatient psych unit, they're rough places to be in.
I've dropped a few people off there, but I've never been.
Yeah, they're not very therapeutic generally.
I can't imagine.
Mental health is one of those subjects that you have to tread so lightly. There's some people with some serious mental health issues. And then I think there's a lot of people that want to believe they have medical health issues.
Mental health issues?
I think there's a lot of, I don't want to say copycats, but I think there's a lot, we've developed a society where a lot of people want to claim that they have issues. They want to find a way to justify their actions or how they are. But there's some people that have some real mental health issues. And it's one of those lines that you almost can't cross to say, like, when somebody says, hey, I'm having these issues, you can't say, no, you're not. Like I think it's a mixed bag. And so as a psychiatrist, I'm wondering, do you see people that you can look at and that you can evaluate and say, yeah, like you have some severe PTSD and maybe you don't know about it, or just the opposite, like people claiming that, oh man, I have all this trauma and they don't? Or is that something that you can even evaluate for and say for sure on people?
Yeah. I mean, so for a diagnosis, right? I mean, there's a difference between meeting the criteria in the DSM, right? I mean, anybody can memorize that and just say, yes, check the box. Yes. Right. And so what I usually look for, what are conflicts that the person's having versus what are deficits that the person has. And I mean, we could go down the rabbit hole. I mean, it's kind of a fun, elaborate idea, but basically you want to try to understand the conflicts and you want to medicate the deficits. Right.
Okay.
So conflicts usually amenable to therapy, and definitely ketamine. I mean, people who are stuck with EMDR. I mean, EMDR and ketamine work so well together. I always like, especially first responder or complex PTSD folks. It's like, is there a way we can, we're trying to hire a therapist. So if anybody knows a therapist looking for a spot, we have hopefully somebody who's going to come over and start soon. But
that was a question I had. Do you currently have other therapies out? You were doing that.
I mean, I do the best I can, right? Yeah. But I'm one person, and I can't be everywhere and all the time. So between, doing the evaluations, I meet with every person before their ketamine infusion, and then, okay, now I'm also going to do therapy with, it's just a lot. And so we are trying to hire another person
When
to do
you
that.
do that, it's not while they're doing ketamine, is it?
No, just to check in beforehand, and then integration afterwards of checking in, see on how it's going basically. And it's not rocket science, but we all need, I think most of us need a coach kind of person, right? Somebody to hold us accountable, right? How's it going with those things we talked about during the evaluation? So part of that I do spend 90 minutes to 2 hours during the initial evaluation. And during that time, it's hopefully diagnostic, but hopefully therapeutic, and coming up with that plan on how to get the most out of treatment if somebody wants to do it. And so there we're putting in kind of that plan. And then the rest is really just following through on, do we need to make changes to that plan? How's that plan going? Because a lot of it's, the person needs to choose, small things, right? It's all about small achievable things lead to a big change down the line, right? So you're trying to set yourself up for success.
So there's an initial eevaluation. It's not come in and sit down and sign up for a ketamine drip.
Right. Yeah. I think that's kind of what makes us a unique clinic. I think a lot of clinics run by, non-mental health professionals. It's more that, right? They do a medical, you just fill out you're medically cleared, so to speak.
So I'm guessing, I'm going to go off on a tangent on testosterone here in a minute, but as a clinic, most of your stuff I'm guessing is cash pay, or do you guys deal with insurance? Does insurance pay for stuff like this?
We do. It's probably 5 or 6 months ago. We've gone through the ringer with medical billers, and we finally got someone who's amazing, and she's turned our practice around. So what we have is people have Medicare, they sign an ABN, which is an advanced beneficiary agreement. There's all these rules. And then if they are commercial payers, then they sign a financial agreement, and it basically saying they're going to pay the discounted rate. We charge $450 per infusion, and all our prices, on our website, whatever. And then we will submit, if the person wants us to insurance to try to obtain as much reimbursement as we can. And then we're able to refund the patient the difference of what the insurance won't pay. So
the reason I ask is because, we just did a podcast on testosterone, and I just got on TRT about 2 weeks ago. We were just talking about this before the podcast, and it's been it's been a game changer for me. It's all cash pay, right? You go to a physician, and if you're between, $290 and $900, they're like, yep, you're good. And we're not giving anything for you. And I know pharmaceuticals are out there to make money. I know the pharmacy industry and everything else, like big pharma, they want to make money.
Well, and it's deep. And I'm sorry, I don't mean to interrupt.
No.
Just it's funny, the cash pay. I had a mentor, right? That's is kind of a little bit derogatory. People don't realize it, but cash has that undertone of, here, we're doing something under the table, right? We're doing something kind of shady in a dark alley. I'm going to give you some testosterone. Right. And I'm convinced insurance companies kind of created that language, because if you're not taking insurance, you're taking cash, and therefore you're doing something unethical.
But here's the thing, I feel like Big Pharma is making money off of this, because I feel like there's a lot of treatments out there, whether it be testosterone, ketamine, whatever else it is out there, that are actually having massive benefits for people, but insurance isn't covering it. And thus people that even have insurance are forced to pull money out of their pockets. It's more money just being passed around in the pharmaceutical. And it sucks, because I definitely think there can be a benefit to ketamine. I think there's a benefit to a lot of these other things out there, and you're finding them at clinics instead that have the research and the everything to back it up. But yet you're having to pay out of pocket for it because insurance, won't cover it, or they'll only cover a little bit. Yeah. When really it's a better treatment than going to your family physician and them saying, well, let's try these medications. Let's try this. And going on this game for months and years, if not, on all these things to try to treat something that's not actually working the underlying cause. Yeah.
It's super aggravating. I mean, the decisions about somebody's healthcare should be between them and their doctor, right? And that it's dictated by insurance companies is super painful. So if you figure out the solution to that,
I'm feeling it. I think what you're saying is right about the big pharma, trying to, or whoever, making it feel dirty, because they make more money if your regular doctor puts them on SSRIs or whatever else out there. Not saying those don't work, but they're definitely overprescribed, and I'm sure people are making lots of money. So if they can force the doctor to, here you go, here's your medication.
Well, let's be honest. There's no money in healthy people, right? And if you fix people, if you can make people healthy, then there's a lack of revenue. So the money is really between people that are not healthy nor dead. There's no money in dead people, right? It's the people in between. It's the people that need something all the time. If you fix somebody, if you do something for them that's going to change their life in a positive way to where they're not going to need this continual medication, or it's changed or altered their mental status to where now they can focus on things or whatever else, and they don't have this depression, anxiety, whatever it is, then you fix them and you don't make any more money. So the money's somewhere in between a healthy person and a dead person. And I feel like that's kind of where you end up staying when you're on insurances and stuff like that. I mean, it's hard.
Yep. On that note, we talked about the insurance. What about VA? Do they do?
Yeah. We actually get patients coming from Walla Walla, Washington to come to our clinic. We're the only clinic with a veteran cares agreement.
Yeah.
So that's, it's a mixed bag too, right? I mean, we're dealing with the VA and they're sometimes paying sometimes not. But, because we have a veteran cares agreement, we have to accept assignments. So for veteran, it's great. We're able to provide care to veterans, and if veterans don't pay anything for treatment, they just need a referral for ketamine treatment from their primary mental health provider at the VA.
So the VA does do. Oh, that's good.
Yeah. They there was a wonderful psychiatrist, Dr. Brown, who was working at the Spokane VA, and I think he left there. Do you know him?
No, that's the best name ever for a doctor, Dr. Brown.
I think that was. I've never met him, just spoken to him on the phone, and he was working really hard to try to get a ketamine program going through the VA, and I think he was unsuccessful at that, and that's kind of what then triggered where they kind of granted us this veteran cares agreement where they will pay for treatment at our clinic.
That's fantastic. So there you go, veterans, if you're out there.
That's a huge thing. And that's the stuff that you don't see. I mean, in terms of ketamine clinics, how many are there within 200, 300 miles from here?
I should probably know that. I don't know. There's a new clinic who's a wonderful, Johnny Wade is a CRNA that started Kootenai Ketamine, and it's over in Post Falls near Cabela's. And so we've been, we've kind of kicked around how we can collaborate best, because him being a CRNA, me being a psychiatrist, there's definitely, overlap of skill sets. So, so we've met a few times and continue. So it's fun. Most people in the ketamine world, and no, it's weird. I mean, when you have a ketamine experience, you're kind of humbled a little bit, or, for me, we've done enough of them or that, and there's some evidence of it being an entactogen, so that really have empathy or enjoy kind of social interactions a little bit more. But I think a lot of people who have ketamine treatment also feel called to kind of a little bit of a higher mission to kind of like, wow, we have a potential to be a part of the evolution of human consciousness, right? Which is kind of what the world needs, right? It's kind of more of us like trying to get along and, and so among ketamine clinics, especially if there are other people who had ketamine treatments themselves and they're very passionate about those treatments. I had some of the Boise Ketamine Clinic, the owner there, Nicole Rice. She's amazing. She's a psych NP and also a CRNA. She did both of them, which is incredible, but just very open with all the knowledge, right? Here's what I found. Here's what worked for me. Here's what didn't, so there's kind of this feeling of we just all need to work together to be able to provide the best treatments we can and figure out that.
I feel like it should be mandatory that all world leaders and politicians do ketamine or something similar. Yeah. And maybe we wouldn't all be fighting all the time.
That'd be pretty cool.
Yeah,
I think it would be cool.
That's nuts.
Yeah.
Do you ever have people that come out of there with a negative experience?
Yeah, we do.
Okay.
We do. Yeah. Let me think about some examples. I know, because that's an important piece of it, right?
I can give one from my wife. She probably won't listen to this anyway. She used it for depression, and I think she did 6 treatments, but she had one where she got really nauseous and was like throwing up. Yeah. And that was a bummer.
So it was a physical response then.
Yep.
Okay.
No, not a mental response, just a physical response. So she had that hanging over. She got past it and went back after, and it was resolved. But that was definitely one. Yeah. That's a bummer if you have that.
It is. Yeah. And we've, learned a lot about that too. And we have multiple ways to treat it. Like all the nausea medications now on board that we can use.
Yeah.
But yeah, that can still be an issue. If somebody's already really anxious, like, on the edge of kind of having a panic attack, I'll usually say, well, we should call it, right? Unless you can find a way to calm down. Maybe it's not a good treatment, because anytime I've learned this the hard way too, like, oh, okay, well, we'll start the infusion. You'll just calm down through the infusion. Doesn't usually work. The person can still, like, now it's feeling changed, especially if they don't have that experience with any non-ordinary states of consciousness, and that can be really scary.
Right.
And it's normal. I still get anxious before every ketamine infusion, and I've done a lot.
I'm getting anxious just talking about it, to be honest.
Right. because it's the unknown, right? You're kind of going in, and every time can be very different.
Yeah.
Right. And so you're kind of going, okay, what's going to happen today, right? And I'm going to lean into what's coming up, and it's kind of that lesson in giving up a little control, which is scary for all of us, not
right.
So normal anxiety is fine, but if they're already like, you're having to hold their hand and do some breath work with them. Then, unless we can use some mindfulness practices, progressive muscle relaxation, or do some stuff to try to get them chilling, we will call it, and not because that usually leads to bad experience.
See, that's the problem with me is that I'm not nervous about that. I'm the type of person I'm like, all right, well, let's give it a shot. But I'm also very much a critic. I've always heard about you see these people that get hypnotized, right? Somebody touches them and claps, and next thing you know, they're out. I've also heard it's not going to work on you if you don't want it to happen. And I'm the type of person, I am a bit of a critic, and I'm wondering how that plays out to something like this, because there's a lot of me, right? And I'm resistant to a lot of things.
It's when you get the hero dose, buddy, and you don't matter how much you resist.
And also knowing that it's not for everyone, right? It's not. Yeah. I mean, I say with first responders, it is disproportionately higher likelihood.
Yeah.
But it's still, I mean, we're all different. Thank goodness.
Here's a good question. Addiction. Is there a risk of addiction with ketamine?
I would say there's the risk of addiction with everything, but, most people aren't, doctor shopping or using it. I think that it is there, and you have to be cognizant of it. We have a few patients over the last 2.5 years that maybe have been coming in more frequently than I feel like they should, right?
Mm-hmm.
Usually we want to taper off. And if they're not able to taper off, then we need to figure out a plan of why, right? What's going on? Maybe they're liking it too much, right?
Mm-hmm.
But most people would not want to do it every day. I mean, it can be a pleasurable experience, but also exhausting. Like the same way people aren't, using psilocybin usually every day, right? They have and then they're kind of worn out. They need to process it, right? It was kind of intense.
I mean, the experience I had, I did it, and I was like, it was great. Had well-being for a while, and I did not have the feeling like I need to go back and do it again. Like it wasn't an issue at all.
And since you were a psychiatrist that focused on addiction as it is, I mean, I'm guessing alcohol, sexual addictions, whatever else it is this one of those things that people that have addictions to something, whether it be medications, whether it be something psychological, whatever else, is this something that can help them with that?
I think so. Yeah. I mean, there's some evidence that shows it can. It's been, like I heard about it at that addiction conference, right? I think it's all about, the intentions that are going along with it.
Got it.
But we have had, I say alcohol is the biggest responder. And the other ones have been a mixed bag. Like people are struggling with, the stimulants, cocaine, methamphetamines. Maybe those are the ones that maybe the least amount of response as far as, but alcohol by far has been the one where people say, man, I just don't have that craving. Or I was at a party and I said it was easier to say no. I think it can lower the, one of my friend's colleagues, he wouldn't mind me mentioning his name. He's a wonderful man, John Reese. He's used to be a lawyer, still is a lawyer, but he works at North Idaho College, teaches classes there about drugs and the law and all kinds of cool things. But he had a good way of saying how it can lower the activation energy. We can we're thinking about, or even saying no to alcohol at a party, right? There's that kind of build up I still kind of want it, or, but kind of that tension that can build versus it just being easier to go, well, no, thanks, it can lower that, I want to go for a run. I should work out. All that shoulding on our being shit upon, right? We can shoot on ourselves. That should be, and then we can wear ourselves out just thinking about the thing we should be doing instead of just I should just effing do it. And a lot of people say ketamine can kind of lower that activation energy.
That's pretty cool. You have 14 chairs to put together when we get back, by the way.
Serious. He's not lying.
We'll swing by the office first.
Yeah. No, that's something, I was talking to you before this about going on testosterone. That was one of the main things that happened. And I don't know if that has any bridge whatsoever, but I know, like I was telling him, I started TRT 2 weeks ago. And the two biggest changes that I had that nobody has talked about to me when I was asking, I've asked a ton of people for 3 years. I've asked him, everybody.
Oh, it's exhausting. Yeah.
One is my cravings and alcohol. So this is the second drink that I've had in 2 weeks.
Would you like another?
No, fine. I mean, we had a get together with our team the other night, and he was giving me a hard time. He's like, "You're just drinking water. We're all having something."
Yeah, cool.
I had no craving for it, and it was the weirdest thing, man. I've had this complete shift in my diet. I describe myself as a trash panda.
Yeah.
I mean, when my kids, my family go to, my wife will go to, Maverick, and she'll go to get, we're going to go get some treats. And might grab me 2 or 3 Milky Ways. I'll just slam those things. I'll just eat the crappiest food. I can eat a bag of anything. They have to hide stuff from me in the house. I've had no desires, no cravings for bad foods, sugars, alcohol, any processed foods. I literally want meat and like fruits and veg. It's the weirdest thing.
Awesome.
And I don't know, like, not that that has anything to do with ketamine, but
Well,
I mean, it was the same type of thing.
yeah.
Those cravings are all of a sudden gone.
Yeah.
Out.
Hormones are just an enigma, right? I mean, they actually go into every cell and they float right through the cell membranes and affect the nucleus. And so how proteins are made. I mean, hormones, as we know, I mean, they can affect every part of our body and our physiology and so I think, again, even endocrinologists are still with hormones. It's like scratching the tip of the iceberg on understanding exactly how they affect all of our systems.
Yeah. What are good resources if people want to learn more about ketamine? Do you have like any good books you can recommend, or podcast, or other than this one, or things like that?
Yeah. The Voyage Foundation is a nonprofit organization that me and a couple of people started. And it's got some resources there, some links to some articles. And I made a book called The Ketamine Journey Manual. So it's kind of like how to get the most out of ketamine treatment.
Right.
And then our website, northidahoketamine.com. Also,
I will link both of those. The Voyage Foundation, is that the URL?
Voyage Foundation without the on the front of it is the URL.
And it's North Idaho Ketamine?
Yep.
Dude, I freaking love it. We were just talking about changing our name today on a few different things and whether or not to do Idaho experience versus North Idaho. Everybody has North Idaho. I love it.
Yeah.
Yeah.
It's such a different world up here. Yeah.
We got to rep where we
North
came
Idaho
from.
Ketamine. Very cool.
Yeah. Are you guys on social media as well? It's probably not the kind of thing you would.
We might be. We have.
I say that a lot too. I think somebody does it.
Yeah.
We might
I think
be.
I'm not on there. But our Shania is a new person that's helping us out with reception, and she's become our new patient engagement specialist.
Cool.
I don't know what that means, but she's been helping out with all that.
It's important to have that.
Yeah.
Okay. So those are excellent resources. I know people out there will have lots of questions. Dave and I are always accessible to answer these questions. Like I said, I have tried ketamine. Dave is going to. Commit? Commit?
Yeah. We can do the psyche eval right now.
You paying?
Yeah, we got you. Yeah, we'll figure it out. We'll take it out of the team budget. It's fine. I will pay to see that, Dave. Yes. Only if I can sit there and hold your hand. Why are you sweating?
Oh, so I'm game. That's what it is.
I know you are. But yeah, so if you guys have questions, drop them in the comments. You can always reach out to me and Dave. We can talk it out. I'm tired of hearing Dave talk about testosterone, honestly. So if he talks about ketamine now, that's better.
You talked me into testosterone. God.
3-year process.
Table turn.
I'm curious about it now.
It blew my mind. Yeah.
I've been on it like a year and a half now, somewhere in there.
It's very common.
It's changed my life.
Like I said, over, I don't know, 75% of men I see coming are on it. I mean, it's very common.
Yep. So, very common. Yeah. So we will link both those websites in the show notes so you guys can grab that. North Idaho Ketamine and TMS. They are right in downtown Coeur d'Alene, easy to find. John, thank you.
Oh, it's been a pleasure. Thank you.
Yep, that was cool.
Very informative.
Awesome.
It's a good topic to talk about. Mental health. Dave and I are always touching on it. It's super important.
Cool.
Yeah. Thank you guys. We'll catch you on the next one.
Thanks.